Hello everyone, I'm Kriti. I'm the Genetic Counselor from Apollo Genomics Institute, Delhi. Today here we are with Dr. Divya Aggarwal, who is a medical geneticist from Apollo, Delhi. October is known as the Breast Cancer Awareness Month, or the Pink October for that matter, where we majorly work on raising the awareness on diagnosis of breast cancer, the routine the surveillance that we can do, and also make the women empowered to do various surveillance aspects of breast cancer. And today we are here to discuss on the genetics aspect of breast cancer. So we have some questions and Dr. Divya will be answering them to make you understand what is the role of genomics and genetics in breast cancer. So ma'am, one of the first questions that we have is why genomics or genetics in cancer, especially in breast cancer? What is its role in the cancer and breast cancer especially?
So thank you, Kriti. And so we would like to start with explaining that why at all are we talking about genetics in cancer. So one needs to know that all cancers are genetic in origin. By that I mean that a cancer originates in any tissue when there is a mutation or a change that happens in a gene which controls cell growth or cell repair. And when that gene gets defective, that's how it leads to an uncontrolled cell growth, leading to the tumor development. But these changes occur in a particular tissue. They start from a particular tissue. In case of breast cancer, sporadically, coincidentally, by chance, the mutation happens in one of the cells of the breast tissue, and that's how cancers develop. That's why any cancer which develops in any place in our body is genetic in origin. However, there are some genetic mutations which occur in the germline and they get passed on to the next generation. These mutations in the cell growth genes or the cell repair genes lead to something known as the hereditary cancers. So in case of breast tissue, we know that BRCA1 and BRCA2, BRCA1 and BRCA2 are two genes which are extremely important for the cell repair, particularly in the breast and the ovarian tissue. Any mutation that is carried in these genes in the germline, which means that in the blood and in all the cells of the body by a particular individual, that particular individual is predisposed to developing what is known as the hereditary breast ovarian cancer syndrome. So that's why genetics is extremely important when we are talking about breast cancer, particularly in cases of where we are suspecting a hereditary breast ovarian cancer syndrome.
So how common is breast cancer in India and what portion of it is hereditary in nature?
So in India, the data suggests that breast cancer is much more commoner in women than in women in the West. We do not have true prevalence or true incidence of breast cancer because a lot of cases go undetected and unrecorded in the census or in the data. But it is definitely much more commoner. It is a known fact that it is much more commoner here. Worldwide, as well as in India, breast cancer is the most common carcinoma in women. And as compared to West, the African women and the Asian women are somehow more prone to developing breast cancer, as well as the cancer that they develop is seen to be more malignant because it has a typical pathology. A particular type of breast cancer is more common in India, which is called a triple negative type of breast cancer, which is a more sort of a severe variety of breast cancer. So in that way, yes, I mean, it is we are genetically predisposed to having a little more severe type of breast cancer. Now, coming to the hereditary breast ovarian cancer, so how much proportion of the breast cancer runs in the families? That is what we are trying to look at. So, most of the carcinoma of the breast occurs sporadically or occurs coincidentally, and these cases are isolated cases in a family. About 10 to 15% of all cases of breast cancer may be running in the family. And again, this proportion might be higher and might be underestimated because of, again, underdiagnosis. So as of now, what the data suggests is that the hereditary breast ovarian cancer forms about, in total, about 15% of the total breast cancer.
So how can we differentiate between a hereditary and a sporadic breast cancer? What are the genetic testing options available for the same?
So genetic testing, as I said, that it is important in differentiating between a sporadic cancer and a hereditary breast ovarian cancer. It can definitely help. The genetics of cancer actually occurs, the genetics in cancer works on a two-hit hypothesis, a double-hit hypothesis. So the double-hit hypothesis says that the cancer develops in any tissue when both the copies of a gene, which is very vital in the cell growth or cell repair, gets defective. And hence this leads to the chaotic cell growth, the start of the chaotic cell growth, which then initiates a cascade of events leading to clustering of mutations in the other genes. So for a sporadic cancer, for an isolated case, there is a mutation which occurs in one copy of a vital cell growth or cell repair gene in a particular tissue. In this case, in the case of breast cancer, in the breast tissue, the mutation develops, but the cancer develops only when both the copies of that particular gene, they are knocked out. On the other hand, in the hereditary breast ovarian cancer, the mutation, one of the mutation in one of the copy of a vital cell growth or cell repair gene is already present in an individual since birth. So the individual is born with a mutation or a germline mutation which the individual carries in all the cells of his or her body, and hence is more predisposed to developing the second hit or the second mutation in the other copy of that particular gene, which when occurs leads to the development of the hereditary breast ovarian cancer. And if we look at the double hit hypothesis, it also explains the reason why even when the blood of an individual is tested and is positive for a BRCA1 or a BRCA2 mutation, there is not 100% chance that they will develop the cancer, because the second mutation is yet to occur, and the penetrance or the chances that the second mutation will occur vary from 60 to 70% in BRCA1 gene and from 50 to around 50% in BRCA2 gene. So the chances that a person who's already carrying a mutation in the germline in BRCA1 gene, the risk that that particular individual will develop a breast cancer over his or her lifetime is around 70%, but is not 100%. So, when we test the blood sample of an individual, if we have a mutation, which means that there is a germline mutation present in that individual, it suggests the presence of the hereditary breast cancer syndrome. And if the genetic testing is negative and there is no mutation present in any of the genes that are associated with the hereditary breast cancer syndrome, then most likely this particular family or this particular individual is not at risk of having a hereditary breast cancer syndrome.
So that means that having a mutation in BRCA1 or 2 does not mean that you will definitely develop the breast ovarian cancer in your lifetime, right?
Yes, that is correct. There is an increased risk of developing the breast cancer, but it's not 100% certainty that carrying a mutation in your blood, you will 100% develop the cancer. The risk is increased up to 70%.
And when we opt for the test, should we only look at the BRCA1 and 2 genes, or should we look at a wider panel because now that is available? Should we do that?
So the genetic testing, this brings us to the next very important area of discussion, which is what genetic testing to go for, what to test. So genetic testing in breast cancer, either, as I said, that could be done in the tissue of the tumor, or in an affected individual, or in the blood sample, which can be done in the affected or the unaffected, to be able to assess their risk of developing the breast cancer. So when we are testing any individual with breast cancer or who is unaffected but would want to know the risk of development of breast cancer, earlier we used to do a BRCA1 and BRCA2 targeted testing, because these are the genes which are mainly responsible for the hereditary breast ovarian cancer. But now we usually do a focused hereditary gene panel, which includes about 15 to 20 genes that are also rarely associated with the development of the breast ovarian cancer. So usually, it is best to sort of do the genetic testing for the whole focused panel of genes, which are high penetrant genes for breast cancer. By high penetrance, I mean that the risk, if there is a mutation found, if there is a defect found in any of these genes, there will be a considerably high chance of developing the cancer, because there's a huge list of genes which might increase your risk of developing the breast cancer to, say, up to 1 to 2%. So you cannot really, it's not recommended to test for all the genes, but it is definitely recommended to test for the genes which have a high penetrance.
So who all should undergo genetic testing? Say, for example, if I am already diagnosed with breast cancer, should I still get this genetic testing done?
Okay, so yes, that's the key question that we are addressing here today. So, breast cancer patients should undergo genetic testing for two reasons. One is that genetic testing is done from the tumor tissue these days of all the breast cancer patients for their optimal treatment and for their personalized treatments. Genetic testing is done in the tumor tissue of the breast cancer patients to be able to target some therapies, some personalized drugs which are more useful for patients who have certain mutations in some particular genes in the tumor. So that is called a tumor profiling, and there is also a genetic test, but it's not a test for the hereditary breast cancer syndrome that we are predominantly talking about today. However, the breast cancer patients undergo the genetic testing in the tumor tissue for this particular reason. However, if a breast cancer patient is less than 50 years of age, has had a family history previously of breast or ovarian cancer, if there has been a recurrence of breast cancer, if there are primaries of breast cancer in both the breasts, and there are some certain other criteria also which increase the suspicion of a hereditary breast cancer in that particular individual and her family, in those cases we do offer the germline genetic testing, which is the testing from the blood sample of an individual, to assess their risk of this cancer being part of the hereditary breast cancer syndrome. The benefit, or the why is it needed, is because if the breast cancer arose in that particular individual due to a germline mutation, usually these women will need more aggressive surveillance. They will need their management after this particular cancer is dealt with, is also targeted towards screening for some other cancers over the body, whose risk is also increased in the hereditary breast ovarian cancer syndromes. So the germline testing in a cancer patient is done for different reasons, while the tumor tissue testing, which is called the tumor profiling or the tumor genetic testing, is done for a different reason in the cancer patient.
And so you've already addressed the point that if there is a family history, then yes, definitely breast and ovarian cancer gene panel or at least BRCA1 and 2 genetic testing is recommended to understand the individual's risk and also to understand if the siblings or the children are also at risk for that matter. And what if there is no family history, I am not diagnosed with any form of cancer like breast cancer? Can I still undergo the test if I wish to, for that matter?
So you're talking about, say, a 40-year-old lady who walks into the OPD and asks that, I want to get myself tested for the breast cancer. What is my risk of development of breast cancer? And do we have tests that can accurately predict my risk of development of breast cancer? So which brings us to the point that what is the prevalence of any of these gene mutations in the normal population? Is it high enough for us to suggest these gene mutation testing for any asymptomatic individual, for any layman, for any person in the population, for them to sort of go ahead and do the test? So again, that is where the science is sort of lagging behind in developing countries like India, because we do not know the exact prevalence of these gene mutations in our population. We don't know whether an individual who has been well throughout their life and there is no family history of any cancer, could they still be having these mutations? Are they still at risk of developing this cancer? There is not much data, but whatever limited studies there are, in 2000s, in early 2000s, some studies have been done, and they have said that the prevalence of BRCA1 and BRCA2 mutations is somewhere in 1 in 400 individuals. However, some recent data suggests that it could be as high as 1 in 120, so very close to being 1%. So if there are 100 people outside of this room, there could be one who has this gene mutation and who could be at risk of development of the breast cancer. So population-based cancer testing for predicting the risk of development of breast cancer, or for that matter any hereditary cancer syndrome, maybe we will, it's on the horizon probably, but it is still not sort of recommended till we know exactly what is the population prevalence of these gene mutations. Also, another factor which has to be taken into consideration before ordering for a test, before ordering for these screening tests, because they are not confirmatory tests. They do not say whether you will develop a breast cancer or not. They are screening tests, they are predictive tests. So another consideration is that, of course, if you have the mutation, you will need to, there are those surveillance protocols that are in place, and if there is early detection of cancer, by these surveillance, there is definitely much more and much better chances of cure of the breast cancer. However, there are many limitations as well of getting the testing done, and if any individual comes out to be BRCA1, BRCA2 positive and has been well, there has been no family history, and we predict that there is a 70% risk that you will be developing the breast cancer, it does bring along a lot of anxiety, a lot of anxiousness. In some cases, it might lead to a lot of other mental health issues like depression. Of course, in individuals who are up to it, they can plan better. They can, set aside maybe some money for their, if at all they need for the advanced surveillance and for their health. However, in a lot of individuals, it might lead to more chaos. It might lead to a lot of other problems. So the genetic testing, if at all, needs to be ordered. It has to be preceded by proper genetic counseling. The individual needs to understand what are the limitations of the test, what are the benefits of the test. They need to understand that having a positive mutation does not mean that they will develop the cancer. There have been some cases, unfortunate reports, where an individual has been found to be mutation positive and then has gone ahead and forcefully had their mastectomies done. So it's not 100% risk. We need to know, we need to counsel them, we need to tell them that it's a predictive testing. On the other hand, if on such predictive testing, if there is no mutation found in any of these genes, it does not mean that the individual is absolutely at zero risk of developing the cancer. The population risk still remains for development of a sporadic cancer whose genetics I explained earlier. So doing the genetic test in the blood just rules out whether that individual has been carrying a germline mutation since birth or not. However, it does not rule out the possibility of any sporadic cancer, or that individual will be still they will be at risk of development of cancer like any other layman, and hence they need to follow the regular surveillance protocols which are in place. So if you're more than 35 or if you're more than 40, then the regular surveillance needs to be done by mammography or bleak ultrasounds.
So essentially, anybody who's tested positive for breast cancer genes, any mutation found in the breast cancer, is not at 100% risk. They are just an increased risk for developing breast and ovarian cancer. And the same matter, if they are tested negative, does not mean their risk for developing any cancer or breast cancer specifically is zero. It is reduced. So we can give that reassurance to the individual or the family, and then accordingly help them make the decision about surveillance and management and the way forward.
So to conclude, we've tried to address genetics in breast cancer today. However, it is whether a particular individual should get tested genetically to know their risk or their family members' risk of developing the breast cancer. That process should be preceded by a discussion with a geneticist or a genetic counselor, whether there is a patient who herself has breast cancer, or there is an unaffected family member of someone who has developed breast cancer, or there is just a random individual who wants to know their risk of breast cancer. When to do the genetic testing and what test to do, it should be done only after a discussion with the genetics teams and after understanding the benefits as well as limitations of the test. So we hope that this discussion was useful, and you could reach out to us in case of any other queries on at Apollo Hospital, at Indraprastha Apollo Hospital, Delhi. Thank you.
So we hope that we have tried to explain the genetic aspect of breast cancer in this Breast Cancer Awareness Month in this October. If you have any more questions, please feel free to reach out to us at Apollo Indraprastha Apollo Hospital, New Delhi, and the contact details are given below.